Assalamualaikum. First of all, I will explain about the definition of public budget. Public budget is a financial plan that focuses a state's expenditures and revenues for the upcoming or future fiscal year. The budget will be approved by the Chief Executive or the Prime Minister at the beginning of each fiscal year, which then will be submitted to the Parliament by the country's Finance Minister. This process involves the economic, social policies in the country, whereby it's very crucial for a country's economic and social development to meet its objectives. Basically, public budgeting is where the government used its power on distributing allocations to all sectors in our country, including social, economic, health, and so on, after making the measurement and converting plans. For example, we can see from the Budget 2021 presentation, we can recognize a lot of allocations presented by the Ministry of Finance in order to allocate it to every sectors. The finance function acts as an important link between management planning and control through the budgeting process. As a result, it is very essential to look into the government spending and budgeting process to ensure that funds are dispersed equitably and in accordance with the budget plan.
Ministry profile background. The older hospital in Malaysia was Hospital Taiping, and also the first hospital that equipped with X-ray system. Institute of Medical Research (IMR) was founded 1900 with the goal of study infectious disease such as tropical disease including beriberi and malaria. The presently 144 government with 28,000 civil workers in the health sector, but it is still insufficient to deal with the rising number instance of COVID-19. Next is vision, mission and objective. The Malaysian Ministry of Health vision is to harness energy for excellent health. The mission is to lead and collaborate in a variety of areas. The objective MOHD is to assist a person in achieve and maintaining a level of health that allow him to live a productive economic and social life.
The goal of the program is to increase and upgrade health facilities to make things easier for doctors and patients who seek treatment at the hospitals, as well as to improve the health of those who receive treatment there. With an increase in the number of beds in the hospital, the number of non-COVID patients who had to be placed in the hospital corridors sidewalk might be reduced quickly. Furthermore, the addition and upgrading of facilities can have a favorable impact on the hospital's management as well as the patients who are currently residing there. The first activities are reutilizing all health equipment in hospitals. Reutilizing all health equipment in hospitals, such as beds, sheets and wheelchairs, are one of the activities that the government should undertake to provide a comfortable environment for patients in the hospitals. With the increased number of people who have to be admitted into hospital, the usage of all wheelchairs is important. This is because, for now, the hospital does not have a sufficient number of wheelchairs. Thus, repairing and reusing old wheelchairs can save the time of hospital management from waiting for a new wheelchair to arrive. As a result of the addition of patients to the hospital, the problem of lack of beds will inevitably occur. Of course, many of the old beds are no longer in use. To prevent this problem from occurring, the hospital can repair and reuse the old beds to be used for patients. For example, the newly built hospital UiTM offered a staggering 400 beds to accommodate the patients. With this reuse, the hospital and the government can save a lot of money. The objective of this activity is to ensure that the old facilities can be reused in the world. Second activities are upgrade normal clinics into specialist clinics. The existence of specialist clinics in certain areas, such as in rural areas, is also important to maintain the well-being and health of patients there, as they cannot afford to go out to urban areas to go to specialist hospitals. By upgrading government clinics to specialist clinics without destroying existing government clinics, it can also make it easier for patients to travel without having to go to a hospital in the city to see a specialist doctor. It can save both time and money for patients undergoing treatment by bringing the specialist doctors into the rural area. For example, Hospital UiTM in Puncak Alam provides 98 specialist clinics that will assist residents around the Puncak Alam area. The objective of this activity is to increase the number of specialist clinics in the rural areas. The third activities are purchase new equipment to be placed in the ICU. The Intensive Care Unit (ICU) is a hospital department that specializes in intensive care medicine. Adding ventilators, defibrillators, and hemodialysis machines is critical in the ICU. Vital signs monitor is also important in the ICU. It is used to show heart rate, blood pressure, and body temperature using only one device. This equipment is very important because doctors can monitor a patient's critical condition without having to use a lot of equipment and machines. With this addition, doctors do not have to rush to take turns with other patients to use the device if there is an increase in terms of numbers. Next, lack of equipment such as infusion pumps is also one of the problems in hospital in our country. This device is used to pump fluids that can stimulate blood vessels in the body, which require a high dose amount. The government can also purchase the infusion pump from the pump manufacturer. The goal of this action is to increase the amount of equipment in the ICU.
Public budget, in simple words, is the budget allocated to be used on the time or duration side. For Ministry of Health, there are 3 programs that have been set up and also 3 activities are to be done under each program. The first program is called the Increase and Upgrade the Health Facilities at the Hospitals. This program's estimated allocation is about 11,472,505 ringgit. The first activity, which is reutilize all the health equipment, encompasses around 4,313,000 ringgit, and that includes all the tools and spare parts, which calculated in one set for a more affordable price and to avoid money wastage on buying new ones. The second activity is upgrade normal clinics into specialist clinics. Will cost almost 5,434,505 ringgit. The budget for these activities may seem huge, but higher technologies and machineries and safety equipment are crucial when it comes to hospitals. For the third activity, purchase new equipment to be placed in the ICU. As we all know, the Intensive Care Unit, or better known as ICU, requires the best equipment to treat the patients. The lack of those equipments could lead to a bigger problem and worst case, death. So in order to cope with the issue, 1,725,000 ringgit will be reallocated to be used for new equipments like ventilators, vital monitor, and infusion pump.
This program of empowering health management to promote a healthy society is to ensure that all society and our frontline get the benefit for themselves, and it also will help the country to grow for a good standard of living. For example, the existence of awareness program, the society will give awareness to the people about the importance of taking care of personal health during this COVID-19 pandemics. The objective of this program is to improve the health management that give a negative impact during the coronavirus disease COVID-19 that hit our country. first activity is increase the funding in terms of the health equipment for the frontliners team. The government needs to ensure that our frontliner is not being affected with this coronavirus outbreak by increase the funding for the frontliners teams in terms of the health equipment, which is personal protective equipment (PPE) such as face shield, mask, and glove. For example, the government should give every hospital in Malaysia a complete set of PPE for the frontliner in hospitals such as doctor, nurses, pharmacy, radiologists, and the cleaners in the hospital. However, hospital that receive COVID-19 patient or quarantine center that have a large numbers of medical staff, such as in MIRZAN, needs to be give more PPE to protect them from being affected by coronavirus. The objective of this activity is to maintain the frontliners' health in a good condition due to coronavirus disease. Second activity is that the government should update the users of MySejahtera, because as we can see, there are a lot of problems regarding the check-in and check-out access and the expired date of the vaccines. People need to check out from the place they visit on their own, and most people always forget to click the checkout once they have leave the place at the time. And if there is any case COVID-19 in the place, even they are not in the place at the moment, they still get notice that there was a close contact to the person who was positive COVID. To make it easier for the society, the government should update the users of MySejahtera by making it automatically check out within 24 hours. This is to ensure that the society actually is not being involved in or close contact with the person that was affected to COVID on the other days. However, the objective of this activity is to ensure that the users of MySejahtera is easy and has improved for the society. Furthermore, the government should implement a new method in MySejahtera application in terms of the vaccination expired date. 5 months after the second dose of or the booster dose that the citizen get the vaccine will be expired. To make the people aware of their vaccines, the government can implement by giving notice to the people from the application that their vaccine will be expired within a month, and there will be a second notice when they do not take the vaccine dose within a week from the expired date of the vaccine. The third activity the government can do is the campaign of important awareness for our mental health care. The objective of this activity is to give exposure and awareness to our community the importance of taking good care of our mental health. Many Malaysians are struggling to deal with this mental health problem, including depression, anxiety, isolation, and family issue, which have been compounded by the COVID-19 pandemic. Aside from organizing additional public awareness program, the Minister of Health Malaysia should engage the community to ask, listen, and send action. For example, the Minister of Health of Malaysia could invite mental health practitioners to organize door-to-door visit to evaluate community in order to understand their inner needs and problems. In addition to providing psychological first aid based helplines for them to express their psychology concerns.
Now let's move on to the next program, which is Program of Empowering Health Management to Promote a Healthy Society. The total budget allocated for this program is RM3,20,800. The first activity under this program is to increase the funding in terms of the health equipment for the frontliner team, in which it requires the government to provide more daily needs of the COVID-19 prevention equipment for the frontliners, especially for the hospital staff. The total estimated budget for this activity is RM2,522,000. Next, update the usage of MySejahtera. This application has been most crucial on these days for all to move around. A total of RM415,000 will be provided for the development of the application. The third activity is the campaign of important awareness for our mental health care. Since mental health has become a serious problem these days, a special budget is allocated for the campaigns to spread awareness to the public upon this issue, which causes around 83,800 ringgit.
Program of Transformation of Ministry of Health Transportation. In Malaysia, there are 2,000 ambulances still operating and free from inconvenience. The Health Ministry has put forward plan to make transformation of health transportation following the increasingly worrying situation. The number of patients with serious diseases such as heart disease, stroke, and accident that require immediate assistance has increased. The goal of this program is to help patients receive treatment as soon as possible and make it easy for health staff to deal with patients who have serious illness by providing the right medical equipment. For example, if ambulance arrive on time and the equipment used is suitable to the victim condition, it may be can rescue the victim of accident of or suffocation. There are 3 activities based on the program. The first activities program is repairing the damaged ambulance can reduce the cost of the Ministry of Health Transportation rather than buy the new ambulance. It also the fastest way to resolve the lack of ambulance problem, because if buy the new one, it takes time. Most of damaged ambulance will be disposed of, although they can still be used. The second activity is increase the number of ambulance. It can help patients receive treatment at any immediate rate. For example, there are factory workers who had to wait for an ambulance to come for several hours and nearly lost his life due to not getting treatment immediately. So all hospitals and clinics need to add ambulance in order to reconvince the people call an ambulance in case of an emergency, and then they also don't have to wait to get treatment. The objective of program is to increase the number of ambulance to all hospitals and clinics. The last one is improve ambulance in rural area. This service trips to ensure that ambulance are constantly ready to help in the case of an accident, particularly on highway. Highway accident incidents are common, especially during festival. The ambulance service is useful as a speedy rescue. The service simplifies the hospital's operation because the distance to the hospital is far, and dispatching ambulance from the hospital need times. For example, when an ambulance receives a MERS emergency notice, they can go to accident scene immediately.
The last program that has been sketched out is the program of transformation of the Ministry of Health Transportation. The transportation that have been used to carry around patients, specifically ambulance, are at the peak of requests nowadays. Waiting list is just a waste of time, and to solve it, a budget around 294,434,000 ringgit will be injected in order to fill the lack of it. The first activity is repairing the damages ambulance. Daily users and long trips have bring a lot damages to ambulance, not only the engines or the outer part, but also to the medical equipments in it. So an allocation of 4,802,000 ringgit will be distributed for the repairing and restoration process. Next, the increase of the number of ambulance. Repairing may just not be enough, as higher number of public needs for the ambulance increase day by day. And with that, up to 281,400,000 ringgit will be used to buy new ambulance to cover up the request daily. Lastly, improve ambulance emergency services in road area, where we could see many incidents where the other road users intentionally or unintentionally block the ambulance while on their way to the hospitals. In order to cope with the issue, 8 million 232,000 ringgit is being allocated for the road construction on a single lane for ambulances to move around. In conclusion, the program's activities and budget allocation explained before will bring a lot of benefit to all. The government of Malaysia is required to provide more budget allocation for the Ministry of Health because they are the ones that helps a lot in ensuring the health of the public. A deeper research and survey will make our country's health sector becomes better each day. With that, we as a Malaysian hope that the upcoming budget in years to come will focuses more on the health sector.